Welcome back. Let's Get Physical Therapy is an educational podcast brought to you by MedStar Health and hosted by me, physical therapist Becca Schumer. I will be sharing the mic with tons of healthcare professionals with the goal of educating and inspiring fellow PTs and future PTs. We hope you find this both informative and inspirational, ultimately optimizing how we treat our patients and grow as professionals. Please enjoy today's episode. We're excited to have Bryan on the podcast today. He has his CSCS, his ppsc, his CPPS, and his CPT. He is the regional director of the MedStar Health Sports Performance Program and oversees the day-to-day operations of our Harford County facility. He is also the strength and conditioning coach for the Johns Hopkins Womens Lacrosse team. Outside of his profession, Bryan's a husband, father of 3 beautiful girls, and an avid golfer. He graduated in 2011 from Salisbury University with an undergrad degree in physical education and teacher education. During his 4 years there, he played running back for the football team, was a 3-year starter, and captained his senior year, and to this day still holds multiple lifting records for his position. Upon graduating, Bryan completed a 1-year internship with MedStar Health Sports Performance under Jay Dyer, after which he was hired full-time. Since joining MedStar Health, Bryan has earned 4 additional certifications and is continuing to earn more. He has been super successful as a strength and conditioning coach and a speaker at the USA Lacrosse Convention and authored a chapter in the book, Building the Modern Defender by Janine Tucker. Bryan, welcome to the podcast. We're super excited to have you.
Thank you for having me.
You read your bio, so I know a little bit about you, but I do have a couple questions. What is ppsc and what is CPPS?
So the ppsc is the pain-free performance specialist, and that certification primarily is based around a pain-free training. So if we have a client that's experiencing, say, acute elbow pain, it specifically is helping us understand how to keep working out, keep training without aggravating that elbow pain any further, so that they don't feel like they have to just be completely rested. We can actually still continue to train and get healthier. We're just going to work around that pain that we have. And then the certified physical preparation specialist, which is basically an extension of the NSCA certified strength and conditioning. It's just another twist from a strength coach named Joe DeFranco, who has a huge background in training football players. And that just takes a holistic approach from warming the athlete up to then training and then cooling them down. And it just has a very specific process, but it basically is the exact same thing. We are getting the athlete ready from a central nervous system standpoint, and then we are going to go through whether it's a power or strength training session, and then going through our cool down for recovery.
We know our topic on this podcast today is about ACL rehab and how we collaborate and work with athletes to get them back to playing at their level that they were playing at before getting hurt. But first, I'm just curious, how did you get into strength and conditioning? Kind of what's your story? I know you played football, but how did you become a strength coach?
So honestly, like ever since I can remember being in the 3rd grade and writing down like life aspirations and like what you wanted to do, I've always put down like be a doctor, change people's lives, make them healthier. And then as I got older and older, when I was in high school, I had a very acute hamstring tear, and where I actually did my hamstring rehabilitation with MedStar Health. And at that point in time, learned a lot just during my own rehab, working with the physical therapist. And I was like, maybe physical therapy, like ATC, that's a road that I want to go. And then started getting a lot of influence from that area and wanting to pursue that. So as I went to college at Salisbury, I pursued an ATC degree, but I couldn't do both. The university wouldn't allow me to do an ATC and play football. So I had to pick one or the other. So I picked football, did physical education, teaching and education as my degree with a minor in exercise science. And then the rest is history. I've been doing like internships all through college and was lucky enough to connect with our boss, Jay Dyer, and did a long-term internship with him and learned so much from him. And then that was a big influence in continuing down this career path.
I know that you do great work, and I'm excited to have this conversation about ACL rehab with you. I know you work closely with the Johns Hopkins Womens Lacrosse team. I'm sure you have a lot of athletes who have ACL tears, depending on different parts of the season, maybe over the summer. What are kind of just some global things as far as how you're working with them before surgery, during, and leading up to getting them back to the field?
Yeah, so like my role is always going to be a supportive role based on the physical therapist and the doctor's recommendations. So first and foremost, I always take their lead first, and then we program everything back off of that. So if it's a fresh ACL tear and say we're a month or 2 months out from surgery, we're going to be doing everything based on their guidelines. Clearly, it's going to be let's get you as strong as possible, regain as much range of motion as we possibly can before you have to have that surgery. And we'll take that approach. And then afterwards, so surgery just happened, and now they're strictly with their physical therapist. I am mostly just helping with like glute activation, re-strengthening our core, and working on upper body posture and strengthening that portion until I'm allowed to then begin direct work on their lower body.
I think that's a big missing piece with, trying to bridge that gap between PT and strength and conditioning is just because the athlete has that ACL surgery, there are plenty of other things they can be doing with you.
Correct.
As far as core, upper body, and just kind of reinforcing work that we're doing in PT.
Yeah, I think that's exactly a huge missing piece. I think once we have this, I have to go under the knife, there's a completely stop what you're doing and just wait for surgery, where we're missing a huge window, depending on when surgery is, a huge window to help get them back even sooner in a better position than where they would have been if they never did training prior to surgery.
Yeah. How do you navigate those conversations?
Like with the athlete themselves, or
I guess between with physical therapists?
I'm always very like straight up honest and clear that like, you are the person who's directing this. I'm, following your guidelines, and then here's what I plan on doing. What do you think about it? Should we add, change? And then it's always depending on the severity of the athlete, like where they are from a mental and physical standpoint, it's either a daily communication with them on what we need to do, or it could be weekly, it could be bi-weekly, but we're making sure that communication is constant and staying there. Because at the end of the day, like we're all here working to help better this athlete's life and their situation and get them back to playing the sport that they love doing.
There's two things you brought up I want to get into. And one of those is fear of re-injury, or that mental part of the game and getting the athlete ready. And the cool part about our professions is we're spending a lot of time with these athletes, so we can make a great impact. How do you navigate that as far as working with an athlete that may have more fear, that's more hesitant to really hit the weights or get back to sprinting and those kinds of higher level activities?
Yeah, I just try to be as open with them and honest as I possibly can, and just have a very good listening ear for them, because at the end of the day, I think they are afraid of saying the wrong thing that's going to get people to be like, oh, this person just doesn't want to work hard back from this injury, and just getting them to be like, look, we understand, we know how you feel. The training environment is going to be your safest place right now for you to start regaining that trust in yourself and understanding like what you can and cannot do. Everything that we do is going to be literally based off of your ability, and we're not going to push you past that point if we know you don't have that in you. So it's really just building that trust, and hopefully you've already pre-established that trust with that athlete ahead of time in the collegiate setting. Like it's easy for us. We have an incoming freshman class, like the whole summer with that incoming class is building that relationship for when we first see them stepping in on campus in the fall. So hopefully we have this 3-month relationship already pre-established. If the case may be, if one of them were to tear that ACL, it's not like, oh, I have to listen to this person I've just now seen for the first time and spoken to them. So trust is going to be huge. If they don't trust you, then the process is not going to go well for them at all, or yourself helping them out.
I know in my clinic, it's a little unique because we do have access to strength and conditioning coaches like yourself. So we do have that relationship a little more open. It's, I guess, harder if the clinic doesn't have access to that. In every rehab, if I rehab someone versus another PT, they might be in a very different state at 3 months, 4 months. What are some common things that you see that athletes present with as far as like common deficits or things that maybe PTs could do a better job of before they kind of enter into your world?
Yeah, that one's that's a tricky question, because a lot of that is, it depends on the quality of the physical therapist. It can also depend on just how well the surgery went. It depends on what type of insurance this athlete has and how many visits they can actually come in on a weekly basis. If it's a kid who only has limited sessions throughout the year, they're probably only seeing their physical therapist once a week, which means they're now given a 2 to 3 extra days of homework to do on their own. So you really have to navigate that space and be like, is it really the physical therapist that went wrong? Or is it just that we have a insurance company and policy that just is not going to help this athlete succeed? So I've seen kids who haven't even been cleared to jog yet. And so clearly, like, they're way far behind. We still have a lot of atrophy happening. There's a lot of apprehension for what they want to do movement wise. So there's a lot of trust that has to be built into them. And then I've seen kids who you could almost clear them right away. But you just know it's not smart to even do that at a 6 month or even a 5 month process. And you just have to understand like where that athlete is and navigating that process properly.
I think one of the arts of what we do is kind of watching an athlete, how they move, seeing like what they're fearful of, and kind of figure out when it's okay to do X, Y, and Z, because you can get clearance to return back to practice or to playing or whatever. Mm-hmm. But how do you kind of judge when an athlete's ready to do a little more impact or contact or those kind of activities?
Yeah, so I put a lot of weight into how well they perform their plyometric drills. Mm-hmm. So like, how well can they absorb? How well can they touch and get back off the ground right away? What distance are we actually jumping? What type of forces are we producing? I put a lot of value in that. And if we are not at a good value, then I'm very hesitant to give them like full practice set up, even if the doctor's like, you're good to go. Like, but like from a metric standpoint, we're not really seeing it. The ACL might be fully healed, but the musculature around it is not ready to let that athlete prepare 100% of the time. So for me, I try to really limit that ability for them to start early. And I always want to have a conversation with their sport coach before we give them full access to return to practice too. There needs to be a huge understanding that just because they've been cleared to practice does not mean they practice at 100%. Does not mean they do all the volume of that practice. Does not mean they're going 1,000% in every single drill. And I think we lose that big time. It's like we do all this work with them for anywhere between 9 to 12 months. They now return to practice, and you'll get a text or a phone call within a month or so. And they're like, my knees really bother me. Like, what's going on? And it's like, what progressions did we take in practice? Like, oh, I just went full right into it. I'm like, well, there's the issue. It's too much, too fast. Your knee isn't ready for that. We should have had this gradual progression. So there needs to be that immediate conversation with the sport coach that has both the parents involved, the doc, the physical therapist, so that everyone understands, like, here are the guidelines, here are the progressions that we want them to take in practice so that they are the most successful. And I think because we don't have those conversations on a regular basis, we're seeing that high rate of second ACL tear, whether it's in the involved leg or the non-involved leg. And we could just do a better job of bringing those numbers down if we had those communications more.
That's where strength and conditioning is again a big missed piece, like low-hanging fruit that should be incorporated in all athletes return to play.
It really should be. Yeah. And it's great to see more and more high school programs and sport coaches willing to take that leap and like wanting to do the S&C work. I just also wish that there was a certification put in place specifically for them, right? Like, I've gone through the physical education, teacher education program in college. There is no class that you're mandatory to take for like program design, exercise technique. Like, none of that is there for you. So I think it's a little bit foolish that our school system allows these programs to exist when they truly have nothing more than like a hobby of knowledge, guiding them and guiding these young kids through these programs. And there really should be like an advisory board of certified strength and conditioning coaches that are helping these school systems implement these programs appropriately and teaching these physical education teachers how to do this better. Because like, you could say like, well, at least they're doing something. It's like, just because you're doing something doesn't mean you're doing it right. You could be actually making the situation worse. Like, sometimes it's just better for your body to naturally develop than it is for you to train incorrectly.
Obviously, there's different kinds of grafts that are done with the ACL, be it hamstring, quad tendon, patellar tendon, allograft. Do you notice a difference between lifts depending on what kind of graft that they had?
Like the difference with like that I've seen between like a hamstring graft or the patella is just like how quickly we can get into that like knee forward flexion movement, like getting deeper into our ranges of motion. If we have our patella graft clients, like we can't get them into that position soon at all, which I dislike. I like being able to work on that ankle range of motion, not losing it, so that we're not forcing the knee to have to move more than it has to in dynamic movements. From a hamstring client, it's a little bit alarming when we try to start getting into those deceleration high velocities, and they're still like, ugh, like my hamstring just does not feel good. It's like, yeah, we still have to work a lot more on that eccentric strength and rebuilding that hamstring tissue. So there's a give and take on both sides. You really have to just understand like what problems you're going to occur down the line and how do we address those.
As far as return to play, I know in PT we have certain tests that we do, like hop testing, we do the biodex, certain tests. Are there any specific tests that you look for as far as percent ability to lift for squat, deadlift, broad jump, that kind of stuff?
So from a lower body perspective, when we do a unilateral test, so for instance, I like doing a Bulgarian squat or like a rear foot elevated split squat. I'm just looking specifically at a, involved to non-involved ratio and how close are we. Usually if it's in an athlete who has done strength and conditioning before and they have experience in doing these lifts, we'll see work hard to get that involved leg back equal to the non-involved leg. So there's definitely a lot more work. And I love doing that because that really gives us a true sign of like where we're at. If it's in a non-experienced athlete, one who has not done strength and conditioning before, a lot of times like physical therapy does such a great job at re-strengthening the involved leg that it's so much stronger than the non-involved leg. So then we actually have to do more reps and sets on the non-involved leg to get that one back up, because now that one's technically at a rate for injuring that one as well. So we have to just be cautious and aware. So I like the Bulgarian for my unilateral work. I will repeat the same jumps that most likely they're going to use in the return to testing, just to help them get more reps, feel more comfortable about it. Because that's a huge thing. It's like sometimes, I have an athlete come up to me and they're like, "Hey, I'm so excited to have my return to play jumping tomorrow." I'm like, "Cool, great, like kill it, you'll do well." And then they come back to me the next day, they're like, "Hey, like they just brought me back and I just went right into it. I did no warm up, I did nothing." So they're like, "I felt very uncomfortable." So like the more we start adding in those drills for them, those tests as markers when we're doing our assessments on a weekly to monthly basis with them, it makes it so much easier for them. There's less stress when they have that day. So there's a higher percentage of them being successful. And then from a like bilateral movement, I use both the trap bar and the squat just to see a bottom up approach and how they're moving well under a load, and then a top down approach to how they're moving well under load. So being able to see like, is their core strong enough? Are our hips compensating one way or another with a shift? Do we still have like valgus tendencies? Are we collapsing at the ankles? So both of them gives you a unique standard to be able to see that in both directions.
As far as running, I know we spend a lot of time on technique and making sure they're landing correctly and have enough knee flexion and all of that. What are some common things that you see in athletes returning to running and even sprinting? Are there common things that you see post-op?
So for us, it's honestly just kind of trying to get them back to that natural gait. And so I think it's important for the athlete to find time. And sometimes like we need to go with them on these days just so they understand like what we're looking for and get to a track or at least to an open field so they can get those stride outs up to about 75% so we can see how that leg is turning over. Because if they're still lacking the ability to flex their knee fully, then like when that foot comes pulling through on that sprint, it's not going to be coming off the ground that high, which means we're going to be shortening the stride length and they're going to have that big limp that we need to try to get back out of their stride. So I think that's one of the most important things for us to do is seeing that in a larger space, more open space, and then videoing it so that they can truly see. Because a lot of times they're like, "No, I feel fine. Like I don't feel anything." And then you show them that video, you're like, "Oh my goodness." So I think that's huge. Always videoing so that they can see what exactly how they're running, because their body feels like their body. They're not going to be able to tell normally how they're running. And then from a sprinting standpoint, I think it's important for us to first load them in a like sled push position so they start to get that feeling of what the force is going to feel like when they really have to push through the ground, and begin with the sleds and then slowly progress them into that hard max effort sprint from there. And always just keep it short distance too. Like just start with a 5-yard effort and let them coast and slow it down. And just as they get more and more comfortable, we can keep slowly building that up. We can add very specific drills to help lengthen that stride and get the frequency back. But I think it's important and imperative that we start short and just slowly build that sprint distance up and not just shoot for the moon right away.
Another challenge of later stages of ACL rehab is we're juggling trying to do the strength training, the plyometrics, and making sure we have the core, upper body, kind of everything. How do you juggle all of those things? Like, what would a typical week look like? And again, I know it depends on the athlete and what their deficits are, but typical.
Yeah, it does. And so normally an athlete is still working with the PT. So if they're still with their physical therapist, I'll allow their physical therapist to do their plyometric progression program the majority of the time, because that's the most aggressive part of their rehab at that point in time. So I'd rather the physical therapist take over that. And then I will do everything that's complementary on top of that. So I'll do a lot of the volume training to try to help get back the atrophy that they have experienced in that side. We'll start to do a little bit more max effort lifting if it's applicable, and then we'll start getting into some Olympic lifts so that we can start seeing some velocity under load happening there as well.
We get stuck in that 2 sets of 10, 3 sets of 10.
Mm-hmm.
So I think a big part of that with your role is changing up that rep scheme and trying to work on strength versus power versus hypertrophy and all of that.
Yeah, and then like in a perfect world, there's definitely a point in time for like block training, like when we do like, okay, we're really only going to focus on like building strength. We're only going to focus on, your strength endurance or building more and more size. But like once we get out of that phase, it's important to take all of those categories and piece them together. So like, your power is going to come from your opening block where we're doing high CNS work at a max velocity under a lighter load. And then we can get into our second block, which is dedicated to strength. And then our accessory work can be strength endurance and hypertrophy at the very end, because it's a little bit less intensity of the weight that we're lifting, but it's a little bit higher volume. So I think it's important to like understand like what type of format makes most sense for that client at that point in time.
It kind of talked about returning to lifting and some fear avoidance behaviors. Power is a big one that I see an issue with jumping and just getting that power back. What are a few techniques that you use to work on that?
So power to me is them not able to honestly like get out of that bottom position or wherever they might be seeing their power loss at. So I am a huge proponent of almost taking like a triphasic approach when we do that, and working a lot of eccentrics early on so that they know like, okay, I have control of this full range of motion under X load. It might even just be body weight at first. And then taking them where they have their biggest problems and then progressing them into an isometric phase and like, let's push as hard as we can in this one specific joint angle. And let's progress through the full range at every different angle. And then from there, going through like our concentric only and like them really pushing through and seeing how hard they can go, and starting off at, let's go with a moderate weight under load and pushing as hard as we can. And like, we'll do a little bit of a contrast and like, let's do it at body weight and let's see how we feel. So I think it's really important to take that type of approach, because a lot of times like kids don't have that good starting strength. And yes, it's more of a strength deficit issue, but it could just be in a very specific range of motion. So going through that model allows us to see like what true range of motion is their issue, and let's address it, let's fix it, and then let's keep moving forward from there.
Obviously, there's different athletes. Some athletes we have to kind of like pull back, some we have to push a little more. Mm-hmm. How do you hold those athletes back that are rearing to go and aren't quite ready to go? How do you have that conversation with them?
Just being honest with them and just laying out the facts to them. And sometimes it's sharing a story about another athlete. You're like, hey, look, like I've seen this situation and I gave that athlete the ability to go ahead and push through, and we had a huge setback. Like, I don't want that to happen to you. Like, we live and learn from our mistakes. We've learned from one person before doing the same thing, and we thought that they were in the exact same spot. And we're like, okay, yeah, let's get it going. And then boom, something happened. So I think it's just being honest with them and being like, you are not ready. There is a high rate of probability of you're going to do something. You might not re-tear it. You might not do something that's that serious, but you could potentially hold yourself back from reaching your end goal when you want to get started. So just trust us in this. If you want to do more, we'll allow you to do more, but just in a different area. It might not be directly on the involved leg, and maybe it's with the non-involved. Maybe it's, working on your upper body. We'll let you push a little bit harder there so you feel like you're doing more, but it's not necessarily in the way that you want to get it done, but we're still giving you the option. So I think we just need to be really just honest and upfront with them about that, and not be cookie cutter and like be afraid of hurting their feelings. And I think you get more trust from the athlete when you do that. So
we work a ton on injury risk reduction. I don't like using the word prevention because I don't think we can prevent things, but we can optimize what we can to reduce our risk of injury. As a strength coach, what things do you implement to hopefully help athletes not tear their ACL?
I'm a huge proponent of warm-ups. I think it's very underrated. I think too many people believe that they can just get up, do a quick quad stretch, do a quick hamstring stretch, jog in place, and then their body's ready to go. That only lasts when we're up to a certain age, and then we really need to start implementing a proper 8 to 15 minute warm up to get these kids' body temperatures, increase. They should be sweating, blood should be flowing, and if we're not seeing that, then they're definitely not fully ready yet. And in the same sense, it's like you see some kids still yawning, right before like an opening draw or before an opening kickoff, and it's like that kid's not even fully awake. Like he's not ready to have this impact happen whatsoever. So my biggest thing is just teaching and educating our youth on this is how we properly warm up. These are the steps that we want to take. This is how you should feel after doing a great job with your warm up. And now look at how much better your performance is. And they may not want to sit there and, do the specific foam rolling on each muscle group that we're going to be working on for that day, or doing the movement series that we're doing to help create more mobility with that joint. And they may not want to do the activation that we're doing, but it's at least constantly educating them, getting them to feel how the muscles should contract, and then making them understand, like, this is how we jump further. This is how you're going to be able to sprint faster or decelerate better. So it's educating them on the warm up. I think that's my biggest proponent. And there's a research out there from a former Hopkins doctor who's now at Harvard, and I'm forgetting her name right now, but she did a test on warm-up specifically, and she noticed that kids who did a proper warm-up had up to a 72% reduction probability in a lower body acute injuries, which I think is huge. Like if you can just do a proper warm-up and then there you are, you're at least 72% less likely to have an acute injury. Like why would you not take that 8 to 15 minute time frame to just get yourself ready before playing? And that's like my biggest frustration, because you hear these kids in club games during the summertime or even during the fall, and they're like, hey, did you guys get warmed up before your 3 days of games? Like, no, we showed up about 10 minutes beforehand. We walked to the field, we threw the ball real quick, and then we were playing. And it's like, what are we doing? So there just has to be a lot of education that has to happen. And parents need to be willing to understand that and make sure that their kids are getting there with ample enough time to do just that.
You brought up another interesting thing I was thinking about. Sometimes we treat a lot of students, high schoolers, you're at the college scene. We get athletes that come in and they haven't slept, or they just had 5 exams and they're exhausted. And this whole plan that I had set out is not ideal because their nervous system is already done with. How do you tackle that as far as, you're working with a bunch of people, but every student brings their own experiences to the table?
Yeah, I just approach it as on an individual basis. So if, like, for instance, I have, there's a lot of sickness going around right now. And we've had some athletes that have been out for a few days with the sickness, and they come back in, they're like, hey, I'm ready to go. Like, let's get after it. I'm like, whoa. Like, no, you've actually been like pretty ill for the last 7 days. We're going to take it very easy today. We're just going to do non-impact, moderate aerobic work on the bike, very low intensive. Let's keep your heart rate between 120 and a max of 140 for 15 to 20 minutes. Let's just get you going on that. Let's see how well we're breathing when we do that. And then let's take it nice and easy in our strength training program. We're probably going to have to reduce the volume a little bit, reduce the intensity. Let's bring you back gradually over this next week. Let's not just shock your system right away, because you can honestly have a rebound and be sick all over again. That's the last thing that we want to do. So I take it from a very individual approach. Like if we're at Hopkins, we have a system that we use to track all the girls' sleep, stress, soreness, and that gives us an accumulation score for them on that day. So if we see certain numbers, we in the coaching staff immediately we're like, hey, we're going to give this person less speed reps. We're going to keep them out of this drill, but we still keep them engaged and active, but we may just be like less impact right now. And we try our best to help promote recovery and continue to educate the girls and the guys that we are seeing to understand, like, recovery is how you get better. If you're not recovering well or efficient, then everything that you're doing just is not going to help you.
Kind of started to wrap up here. Is there anything from either PT, strength and conditioning coach relationship you want to touch on that we haven't yet, or any other pieces of advice for PTs as far as how we can do a better job with strength coaches?
I just think it's just constantly having that open line of communication. Like when we get a fresh ACL in the door that's starting PT, it's like right away trying to like set the introduction. So like if they're brand new to MedStar and with physical therapy, which means they probably have never seen any of our strength coaches on staff before, like let's start the communication right away. It's like, hey, so-and-so, you're doing physical therapy with me. Let me also introduce you to our strength coach, so-and-so. This is who you're probably going to be working with at X time. Let's start building the relationships. When you're doing stuff in here, we're going to start sending you out when we're able to start doing a little bit with them. And that just helps build that trust. It helps generate a better relationship. And ultimately, it's going to help to more success with those patients.
One question that we're going to ask all of our guests is, what is your favorite quote? If you had to pick one.
It's funny. Like I've always seen this quote, and then this quote was introduced to me by my high school football coach, and we had it on our weightlifting shirts when you hit a certain total weight club, and on it said, if you want something you've never had, you must be willing to do something you've never done. And still to this day, I have not found out like who actually is the person who voiced that, but that's something that always clicks with me, because it truly resonates, right? Like if you want to achieve something in your life that you've never had the ability to achieve, like you must be willing to go through something more. You must be willing to stay up later when you have to try to work harder towards that goal. You just got to be a little willing to change up what's already going on to reach something you've never had. So that always resonates with me. And that's something I try to carry on and push with my athletes as well.
That's great. Where can people find you?
So I do have social media. I'm such like an often on kind of guy when it comes to it. So I do have an Instagram handle, which is just Coach B. Woolson on there, and they can find me on there.
Thank you so much for being here, Bryan. It's been great having you.
This was a great conversation. Thank you, Rebecca. I appreciate it.
Thanks for listening to the Let's Get Physical Therapy podcast. Be sure to subscribe to our podcast and follow us on Instagram at MedStar Health PT. If you've enjoyed today's episode, please give us a 5-star rating and leave a review so we can reach more listeners just like you. As always, we appreciate your time and hope you join us for our next episode.